Welcome to What the Health? Where anything health is fair game as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan and Angela Toro.
And welcome back to another episode of What the Health. I am Dr. Dan here with my co-host,
Angela.
And Dr. Riley.
Welcome back, everyone. So Angela will give the...
You guys know the drill at this point, but we're here for informational purposes only, in no way offering individualized medical advice. Always talk to your trusted healthcare provider before making changes to your routine. Although I feel like what we're talking about today, we would be the trusted healthcare providers, but... Yeah, so well, hold on. Dr. Dan has his, he was just running over to turn the phone off, because of course...
We're good, yes, because we have this very high-tech level recording center.
As we're huddled in our back office.
Look, one day we'll have a space as nice as Joe Rogan, but it is not this day.
We put our money into what helps you guys, not the podcast recording equipment.
Yep. One day, maybe.
But anyway, you had your funky title for today's
podcast. So today we are talking about trigger points, IT bands, TFLs, oh my. I was going to say TP, IT, TFL, oh my, but basically we're going to talk about trigger points today.
Big buzzword.
So yeah, big buzzword in the healthcare field. So why don't we start with the simple definition. We'll talk about the definition of what the heck it actually is, how does it impact your health and well-being, and what the heck can you do about it. So there's kind of like the three overarching things that we want to talk about. So do one of you want to start with what the heck a trigger point actually is? Because we can all find them very well based on what we do, but... Yeah,
so I mean, honestly, it's funny because we were looking up and there doesn't seem to be one concise, but essentially it's a hyper irritable spot in a taut band of skeletal muscle that can cause pain and other reactions when stimulated. So it's essentially a sensitive area of the body. So it's a lot of, you figure if there's within that skeletal muscle, it's going to be if it's a tight area in general, so we'll talk about kind of the different areas, but you'll notice a common theme is they're all in kind of smaller areas where maybe different joints come together, so there's a lot of connections coming together and a lot of chances for something to get pulled on or aggravated.
Well, and I think if we kind of go to baseline, very, very basic, anatomy, physiology, and, the way that muscles work, skeletal muscle is voluntary muscle, meaning that I can think a thought in my head, and I can say, hey, I want to bend my arm. And by processing the thought in my head, there's nerve messages called your motor messages that are sent down, and those are some of the fastest nerve impulses in the body. I think it's over 200 miles an hour or something. I'm going to go back to see, it's like we learn all this information, but the nitty-gritty details don't always stay up there. But so those nerve messages go down to the muscle, and I think, hey, I want to bend my arm and bring my hand up towards my face, like the action of, making a strong bicep position. And those nerve messages then go down to the muscle. There's little neurochemical communications that happen then at the muscle where calcium is released, and then the proteins, that the long strands of and bands, the long strings that make up a muscle fiber, then start to contract, and they pull that muscle and contract that muscle, so it shortens the joint, and then it moves the bone, it moves the joint. So that's essentially the easy way to think of it. But I just talked about the motor neurons, so those are the messages going from the brain out to the muscle. But then there are also sensory nerves, okay? And those are the nerves going from the body back to the brain, and that's how the brain picks up all its information about the rest of the body. And there's different types of sensory nerves, really based on the receptors. And so there's temperature receptors. You touch something hot or cold, your body can recognize, is that hot, is that cold? There are pressure, there's chemical receptors, so the body can pick up different information about chemicals going on in the bloodstream and the surrounding cells. And then there's pressure receptors. So like if I press down on your knee, Ange, just with my finger, you can feel the pressure of my finger, okay? And then there's light touch too. So if I just, I know, right? So if I just rub my finger like a feather along the surface, there's light touch. Light touch and pressure receptors are different. So, and I think there's a couple, again, going back to the definition, because it's not really settled what a trigger point truly is. I think it's a multi-factor complex, right? Because, when you work a muscle, okay, the idea is you're actually tearing a little bit. You're creating these micro tears in the muscle fibers. And when you start to break those muscle fibers down, then they start being built back up in a more dense manner. There's different ways, you talk about tone of a muscle versus bulk of a muscle. And there's different ways bodybuilders, gymnasts, men versus women, can bulk versus tone the muscle. But, it's still, when you're working a muscle just in general, you're breaking it down and then it's being built back up. But that process is mildly inflammatory, right? So you're breaking down the muscle. So the body goes through a natural inflammation process because when a cell breaks, okay, then there's a chemical reaction that happens in that area to communicate to the brain that, hey, that area is broken. And so that's where the chemicals are released from surrounding immune cells and lymph tissue and blood vessels open up to create a swelling and allow, other, chemical transmitters in the body to go to that area to help heal and strengthen and heal, essentially heal that area. So when we're thinking about a trigger point, if that muscle tissue breaks down a little bit, and now you have an increased swelling in that area, and it's starting to build back up in a denser manner, well, now you can actually create this pocket of swelling that sometimes gets trapped in there. You have those chemical sensors, and you have the actual physical tightness of the muscle. And as muscle is laid down, sometimes if it's being pulled on abnormally, it might be, it might start recovering in an abnormal manner. And so now you've got both the chemicals and the swelling that's trapped in there, but also then the tightness of the musculature being pulled, maybe perpendicular across muscle fibers instead of in a parallel manner. So I think I kind of exhausted that a little bit, but again, it's still, kind of I don't want to say confrontational, but exactly what it is, it's still kind of up in the air. But at the end of the day, it's funny because when you go to a chiropractor, you go to a massage therapist, you go to a physical therapist that's very in tune with, how to find those, people are always like, well, how do you know? You always go to the right area. You always or we can find an area that might have been pulling, and then that refers
so I was just gonna say,
shooting, a pain or a throbbing, or I like to use the word pulsing, up to the area where they are having pain. And I think that's what's important to the discussion today, because so many people are like, oh, I have a pain.
Right there,
it hurts right here, or, and then they point to it. But then we can find a trigger point that might be, several inches or, in a completely different area, even across the spine, opposite side of the body that could be pulling to the area of where they're feeling pain. So I think that's part of the discussion of what we want to, talk about. So that's kind of the definition of a trigger point. I guess maybe we could get into a little bit about how and why they might get there. Do you have any experience with that?
I think it's, kind of similar to what we look for in the spine, the musculoskeletal system in terms of micro traumas, macro, so small repetitive traumas, or, one big incident like a car crash, if you're, same with the ligaments, if you're getting that whiplash injury and your head swings forward and comes back, you're stretching muscles, ligaments, tendons, all of that. The body's going to repair those. So essentially you could get trigger points from that, physical, chemical stresses, emotional stresses, just, even mentally when you get stressed out, you tense up, you don't breathe through the diaphragm. you start breathing through the neck and the chest, and then those muscles get irritated, and you can lead to multiple, scalenes. All those in the neck get trigger points, and those are nasty too.
Diet along with the chemical, I mean, I always say I have my sugar spot.
Yeah.
It's like around the holidays when it's like, oh my god, I honestly remember that one year at Christmas. Remember, it was like Christmas Eve. We were at mom's house. I'm like, oh my god, Dan, I can't breathe. I'm like, I felt like a rib was out, and like, can you just? And you're like, you just said it was like I was so inflamed things like that. Again, putting that massive amount of stress, and again, that's probably a pre-existing trigger point. Just for me, it's from my years of punching, so it's that left shoulder, But again, like another one, again, repetitive motion, that repetitive physical trauma. So runners, if you have that constant impact, fighters with the constant, the punching, anybody that does a throwing sport. So
any one-sided sport,
golf,
tennis, golf, pickleball is now the big buzzword. Like anything one-sided, bowling, one-sided sports, although they can be they're a blast, right? We love to golf with,
I'm like,
you like to go to Top Golf.
No, but I remember I screwed up my shoulder.
You did. But it's like anything one-sided. It's just the body is not meant to be one direction constantly. I mean, that's what someone like Tiger Woods, who's had 5+ back surgeries in his career, and it's like, again, the man's one of the greatest golf athletes ever, but that wear and tear, that repetitive swing at, he's swinging the club at, how many 100 miles an hour, and creating that whip and that ball speed and that twist in the lower spine. It's detrimental, down there. Now, that doesn't mean that you can't recover from it and do, specific, routines and recoveries, but when you're doing that one-sided stuff, and interesting, you talk about the repetitive movements, but how about the repetitive non-movements?
That too,
So, again, sitting in front of a computer, and you mentioned the scalenes, which are muscles just up the side of the neck, for those who are listening and don't know what that is. But it's like, we sit and then we slouch, shoulders naturally start to roll forward, the head naturally starts to come forward, and then if you're sitting at a computer using your mouse and maybe reaching for your mouse a little bit or reaching for your keyboard, it's like everything in the front part of the chest tightens and the front part of the neck tightens, and it pulls everything forward. Well, when you have that position set up and you're not getting good healthy mobility, I think that's part of where a trigger point will start to flare up, when it's not getting its normal healthy range of motion, through a stretching and mobility practice. Then, when you are using it repetitively, it does start to break down, and in the healing process, it gets stuck. And that's kind of what we then can feel. We can literally feel, people are like, oh, how do you know? What are you feeling that I didn't even know that hurt until you touched it. And it's like, because, we're taught in school, where medical doctors, again, the first year and a half to 2 years of chiropractic and medical education is almost identical in terms of, what you're learning in the classroom. But where we start to separate, where, medical doctors go and study pharmacology and, drugs and surgery, chiropractors are going and studying hands-on the body and how the biomechanics of the body move and bend. And it's like, and we are taught very specifically, when we're feeling down the spine, we're feeling for pockets of inflammation, we're feeling for tightness, we're feeling for asymmetry, we're feeling for, asymmetry of motion. So, I can run my fingers down someone's spine pretty easily and find that, pocket of swelling that I know will be tender if I press on it a little bit more. Now, again, that's just one, way that we evaluate. But again, once you start to become in tune with what you're looking for, massage therapists have that art too. It's a skill and an art form that you can continue to develop. Some people have it naturally. Some people are kinesthetic learners and they naturally have that ability to start picking that up. But it's like, it's a skill and an art that you can continue to hone. And again, you go to a chiropractor or a student chiropractor that's just learning how to do it, and they're getting their hands on someone, and you can just tell the timidness that they have have with evaluating someone versus someone who's been doing it, 10, 20 years, and it's like, boom, I gotcha, I got the spot. And so when the importance of that is, well, what do we do about it? And what do we do about it? And what are they causing? What is it leading to? So I think the importance, and we talked about this recently, have some patients who are, being pains in the butt, literally, right? Where they've got like a couple points in that lower spine that just don't seem to be dissipating or letting go. It's like based off of everything else that we're doing, everything is changing nicely, but like, they just almost seem like they're stuck with that, like one nagging, point that just won't let up. And so, we had that conversation where it's like, check these muscles and some of the tightness in the muscles and see if we can release those to, make an impact. Because I can't tell you the number of people, you mentioned the knees earlier, Angela. When I was running my marathon, or training for my marathon, that was over 10 years ago now, I was getting this pain on the outside of my knees, both sides, almost debilitating to the point where I was, I didn't think I was going to be able to, continue to train and continue to run. Well, I had known about the foam roller, but I wasn't really using it on a regular basis. But I started doing a practice called foam rolling, where you're laying on a high density piece of foam and rolling out the legs, which is the IT bands down the side of the legs. Okay. So now why is that important? Well, those IT bands, they insert, okay. It's basically a broad band of connective tissue that, connects the front quadriceps, in the thighs to the back of the thighs, the hamstrings, and it goes down the outside of the legs. And because they insert through there, if you have a buildup of trigger point through that connective tissue or the musculature right underneath that, and it starts to tighten that area, well, that pulling, that tension has to go somewhere. Well, it's going to go to the area where it inserts. So I start hitting trigger points up in my leg, up around my hip, and then it starts releasing my knee pain. And sure enough, I was able to continue to train and able to run my marathon. And so we have people that come in all the time where it's like, oh, I've got this hip pain, I've got this low back pain, I've got this, butt pain, this knee pain, this ankle pain. And we find, these spots, these trigger points in the musculature surrounding it. And we spend some time either ourselves or, through stretching. You teach a lot of people how to stretch these muscle groups. We can do adjustments and, pressure work around, around that area. And then we have a massage therapist in our office. Sugar is absolutely amazing. Sugar, our massage therapist, not sugar that you eat. But, we can take some time on like trying to get those released. And again, that's where trigger point therapy is an entire, it's an entire profession. It's an entire specialty within, massage and, chiropractors, massage therapists,
and the way you work with trigger points is very different than what, or can be very different than what you would think. So I know personally, I've been using Sugar for years, and
Sugar the massage therapist.
Sugar's massage therapist, yes. And personally, I like deep tissue massages. I like the feel of them. and so for years, she was beating me up because that's what we both thought I needed. And I would be flared up for days, and certain things weren't getting cleared out. And finally, it's like, she's like, I'm going to try, the one day she's like, well, I'm going to try something. And she just did this really light, soft tissue pressure work kind of around one of my big trigger points in my low back that was always an issue. And we literally both felt something just like, it was like it melted. I can't even describe it. Yeah. And just since then, she's really figured out, she's like, okay, I might like the feel of a deep tissue massage while it's happening, but my body clearly responds much better to the lighter pressure work, especially around those really tight areas. Cause it's like when she was going really hard, it was just intensifying and instead of letting go. Just my massage last month, I'm like, I was working out the day before and I'm like, why does my ankle hurt? I didn't do anything. It was just, I was doing, step ups on the box, and every time I'm stepping down, I'm like, that really doesn't feel good.
Yeah.
So I mentioned it to her, and of course it was coming up from my piriformis up in my, basically my piriformis is what you sit on, essentially. So again, if you're sitting all day, it's another common one that's flared up. And so it's like, I was having all these weird things that were hurting on the left side, and it was all coming from that one spot, from my back all the way down to my ankle. And by getting that to release the next day, I'm like, everything was gone. Like that. It's amazing. So I always call them the magic buttons. I'm like, she finds all the buttons.
Well, that's my oldest son is starting to, train for the high school, or not high school, the middle school soccer team. And again, before it's just always been like recreation club stuff. They have practice once a week and a game on the weekend. But now it's like practice every day, 5 days a week when they don't have games. And, on the days they don't have practice, they've got a game. So it's like, 5 days a week, he's going hard. And he's a big kid. And so he's been coming home last year. He had a flare up so bad that he was having this heel pain, like he couldn't even walk. And so, we took an x-ray of his foot. It was bothering him so bad. We didn't see any fracture, but, we ended up determining that it was his Achilles pulling on his heel. So he was starting to get that same heel pain on his opposite foot, recently, since he started those practices every day. And then, so I analyzed, his foot and, ankle, but I got up into his calf, and he had a pretty significant trigger point up in his calf. So I stretched, did some pressure work on it. He did ice his, ice the Achilles and ice his ankle. So again, we just did some, recovery work on it, and, by, within, a couple hours, and he woke up this morning. I mean, it's flared up really bad over the last couple of days, but he woke up this morning and it was like significantly better. So, that's the kind of stuff that, my heel pain. Well, it's like, do you have trigger points up in the calf muscle? Do you...
referring pain.
Yeah, like where is it actually coming from?
And I think that's the importance of, the referral pain pattern. Like, you can go and look, there's books, there's massage therapy books that, have referral patterns of all these trigger points. And again, it's an estimate. It's not exact on every person, but, people with shoulder pain, the number of people that have shoulder pain, that have tightness in their pec minor or pec major, your chest muscles. And again, when you sit all day and your shoulders are rolled forward and everything gets tight there, not only does that impact breathing, but again, you can then start to have this shoulder pain, just from sitting in a poor position all day. We mentioned the golfing, and swinging a racket, a golf club, but that swinging, whether it's backhand or forehand, you can get tightness in the lat, in some of the smaller musculature, around the shoulder blade that can impact, pain into the shoulder. So,
I mean, like the biggest thing I think is the fascia. Like the fascia of the body is, at least when I was in school, some of the teachers you need to look into this fascial work and stuff, just because, you have the fascial connections from, the front of the body, the back of the body, all the way from the left shoulder down to the right hip. I think that's why it's crucial to get checked by somebody who kind of understands these trigger points and how the pain you might be feeling, say, in the right hip could be coming from that left shoulder. Yeah. Sugar's great at doing that. She'll...
Sugar's a massage therapist.
Yeah, she'll find a trigger point in the left shoulder. And if that's tight, taut, it's going to pull on the fascia in the back that transitions to the right hip. And, it could be as far as plantar fasciitis on the right side. It's all because you're altering your gait due to that left shoulder pulling on a hip. As crazy as it sounds, it's scientifically backed. You can look up the fascial, kinetic chain of the body, and you can kind of start to understand, okay, if I have deficiencies on one side of my body, I could have my symptoms on the other.
Yeah. And I think that's important. So fascia, if we're going back to, defining things for people who aren't aware, if you peel the skin off of a chicken, okay, a dead one that you're, prepping to eat, please. It's like, I'm going to have PETA call us.
We're not offering individual advice.
If you are prepping a chicken to cook and eat, and you peel the skin off of a chicken, that very, very thin white layer that's over the muscle, but it's almost attached to the muscle. Or you kind of peel like, 2 layers of the muscle apart, and you get the white web. It almost looks like a spider web sometimes between the layers of muscle. That is the fascial tissue that Dr. Riley just mentioned. And you're right. And what they taught us in school is that it is one continuous web and network of tissue from the top of your scalp down all the way to the toes. And it interacts it's basically the connection point between your muscles, your tendons, your ligaments, your bone, your organs. It literally is one continuous web. It's all the connective tissue that, if it's not one of those things I just mentioned, it's kind of everything else in between. And again, it's a very fibrous tissue, but very, very strong tissue to hold everything together. So it's really an incredible, organ, or tissue to work with in the body. And again, it's like when these things get stuck because they're pulling repetitively in an abnormal way, you're out of alignment. And so you're running, you're walking, you're bicycling, all your movements that you're doing out of alignment. Well, things are starting to pull abnormally. So now you can start to create these abnormal pulling patterns. And so then these trigger points will start to show up. And again, a lot of times there's signals that, a muscle or a tissue is, being overused or not being used in the most efficient way possible. And there's ways, with pressure, stretching, breathing, good nutrition. So you're not eating sugar. You're not, you're not putting those, chemical toxins in the body, that are causing a hyper, inflammatory environment that would add to the repetition of them flaring up. So again, trigger points are common in something like what's what I'm looking for? Fibromyalgia, right? I mean, that's what they literally, like, the diagnosis of fibromyalgia is what, a certain number of trigger points, right? Like, it's like 12 or 15 or more or something. And again, doctors are just, taught to press in to different areas. And again, I think that's a very poor, diagnosis categorization, because I think it's just kind of like I could find, if you wanted me to, I could probably find about 15 trigger points on just about any person that laid down in front of me, if I looked hard enough. So, again, it's like, well, why are they so flared up? And, someone's got that in conjunction with fatigue and, just muscle achiness and, headaches and all this other stuff. Like, that's why you got to look at the whole person and the whole situation and what's going on and what you can do about it. So again, things like, do you have any specific recommendations then, Angela, on what else we do with these, these trigger points if they show up?
I mean, other than massage and the foam rolling, again, working them out, the other thing is, so I really like using resistance bands to help strengthen, because that's the other thing, because we talked about it's either overuse or underuse of certain other muscles. So, especially when we're talking about low back. So I think about, one of our sisters, we have many sisters who was having the chronic low back, and her adjustments, she'd feel amazing after her adjustments, but then it just kind of, the pain would almost come back immediately, and went through some basic resistance band exercises just to help strengthen up activate the muscles surrounding the area where she was having the pain. And then all of a sudden it's like, oh wow, I feel better, because again, it's those muscles, if all the surrounding muscles are weak, that's just all the tension is going right back to that same point. So getting the muscle activation, not necessarily the spot that hurts, but the surrounding areas. Knee pain we talk about all the time. Yes, you want to release that IT band, but you also need to strengthen the quad, you need to strengthen the calf, you need to strengthen all the muscles the glute, even the glute,
glute max and medius.
I say glute med. Nobody works their glute med. That's the gluteus maximus is your butt. That everybody that one
big muscle.
That one people seem to be aware of, but the glute medius is on the side. And because we live in such a, we sit, we walk forward, like we live in this very forward, backwards, we don't do lateral motion side to side. And so that glute medius gets really weak. And then, that pulls on the low back. And
I think it's important to, when you talk about weak, a muscle can be tight. And a tight muscle can be weak, okay? A lot of times people think tightness and they're like, oh, it's strong, it's pulling, right? But no, it's like, if a muscle is tight, because it's it's almost like misfiring. So it's like, you aren't, it's not activating efficiently because it's already, clamped down. It's already contracted a certain percentage, and muscles only activate like 40% of the fibers at a time. And again, it's a whole scientific thing in terms of like, what fibers are activated in a timing when the nerve message, goes from the brain down to the muscle and it activates. But like if a certain percentage of those muscle fibers are already activated because they're tight, because they're set up in a way that, promotes that activation, well, then you've already, you're 20, 30, 40, 50% less efficient because those muscles are already firing. Those fibers are already firing. So that's important to understand, that just because a muscle is tight, doesn't necessarily mean it's strong. It could be very weak. Yeah. And so you mentioned the glute med. So if you sit down in a chair, very often you're not sitting with your feet and knees facing forward. What happens is a lot of times, and you're doing it right now,
you take a picture of Dr. Addy.
Yeah. So what happens is if you just relax your legs, what happens? You're usually your knees spread apart a little bit, and so when your knees spread apart, your leg bone, your femur, is externally rotating. Well, that external rotation is what lengthens, it shortens the length of the glute med muscle. Well, now if it's sitting in that position for 2, 3, 5, 10, 8 hours a day,
Monday through
Friday,
probably weekends too.
Well, now it's shortened its length. And again, you can then start to develop trigger points because of the misfiring and basically the relaying down of muscle fibers in a, cross pattern that is not ideal for efficiency of contraction of that muscle. So now again, you get trigger points and weakness in that glute med muscle, the piriformis muscle, the TFL I mentioned at the beginning, the tensor fasciae lata muscle. I always said it sounds like a coffee drink.
Yeah,
right?
it does. Yeah, I'll think of that with the.
But that's essentially the muscle that attaches to the IT band and attaches it to the femur. And so it really sets the tension and the tone of the IT band. And one way to stretch it is, some of the internal rotation of the femur and, doing the pressure work with the foam roller. So, that's the kind of stuff that, you've got over, we always talk about joint and bones in the body. There's, 206 bones in the body, but there's over 600 muscles in the body. And all those muscles and bones are all interconnected with this fascial tissue. And so it's like, you have these aches and pains, and the easy way to, hush it up is, pop an Advil or Tylenol or whatever. But, that's not getting to the cause of the problem. It might make you feel better shortly, but in the short term. But I guarantee in the long term, you're doing more damage to your liver, your kidneys, your stomach, and you're not actually solving the problem. So all while you are trying to make yourself feel better, your body is continuing to get weaker and tighter, more rigid, and resistant to change. And as we talked about in our most recent episode, we talked about that adaptation. It's like you are preventing your body from becoming more adaptable. And so that's what that's exactly the opposite of health, right? If you want to promote health, you need to promote your ability to adapt. And the one way we do that is we help the joints, the muscles, the bones work more efficiently, and the nervous system, which coordinates all of it. So it truly is like, it's all connected.
It
How many
is.
times do we say that in the
It's
office?
truly
Is all connected. So, I would say if any of this resonated with you, or if you have like a random ache or pain that just will not go away, and you've had it looked at, by other medical professionals, and you're just not getting to the underlying cause of your aches, your pains, your stiffness, or why you have a recurring injury, the same injury over and over again. Every couple, of months or once a month, you have the same, flare up of a joint stiffness or inflammation. If you're having those repetitive injuries, or you're just, not feeling as mobile or flexible as you used to be, like those are all, great. Those are all signs that your body is screaming at you to get checked by, some professionals who, have some information that could guide you to living a more flexible, mobile, adaptable, healthy life. So if any of that sounded interesting, do not hesitate to reach out. We've got a ton of information on our website, ToroFamilyChiropractic.com. Reach out to us directly to answer any questions, any more input.
Nope. No.
Get checked.
Yeah.
Get checked by your local chiropractor.
We have it all here. Chiropractic, massage, functional training. So we can, whatever you need, we can help you out.
Here to help you get healthy and stay healthy. So thank you so much for stopping by. We will see you at the next one.
Have a good one.
Take care.
You've been listening to What the Health with Dr. Dan and Angela Toro, brought to you by Toro Family Chiropractic. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.whatthehealth.world.